Hi, good afternoon, Sarah. It's so nice to meet you.
Nice to meet you too.
So I just wanted to bring you in today. I was very interested after seeing your CV in getting to know you and seeing if this would be a good fit for you and to see if you would be a good fit for our clinic. So how about we just start with you telling me a little bit about yourself?
So I've been a nurse for almost 6 years. I went to my undergraduate degree at St. Anselm College. I graduated in 2015 and I got a job at Massachusetts General Hospital working on a same-day surgery unit for adults. I worked there for about 3 years, but soon realized I did not want to work with adults anymore and wanted to transition into the pediatric population. When I was in college, I thought I wanted to do labor and delivery nursing, but I soon realized I don't really want to take care of the moms as much. I wanted to take care of the babies. So I started my career in the neonatal intensive care unit. I left Massachusetts General Hospital and went to work at Women and Infants Hospital in Providence, Rhode Island. I got about a year experience in their NICU that consisted of 80 beds. And then I applied back to Massachusetts General Hospital, and I now work in their NICU. I've been there for maybe almost a year and a half.
Okay, great. And so you are going to be finishing up the pediatric nurse practitioner program
Correct. I'll
soon?
be done with my graduate degree in August of 2021.
Okay, very good. And so why did you choose this career track? I understand you don't want to work with the adults, but why specifically are you interested in being in the NICU developmental clinic?
I have always wanted to work with kids. I know I don't like to work with adults, but being in the field that I am in, I do have to interact with adults in the sense of parents. But I just love taking care of babies and seeing them grow. Having worked in a NICU for almost 3 years, I can't imagine working with any other population. Like I take care of babies and consider them my own sometimes. And I just working in the developmental clinic will give me the opportunity to see these babies beyond the intensive care unit and how they're progressing into normal life with their parents at home.
Okay, very good. So what would you tell me is one of your biggest strengths and what would be one of your biggest weaknesses?
I would say my greatest strengths would be time management and organization. I get to work at least an hour before I have to be there to look up my patients, get ready for my day or my night. And I am a big person with to-do lists, check-off lists, keep everything organized on what I need to do for the night. And, my plan of care for my babies of that shift. And I'd say one of my weaknesses would be getting too attached to my patients. Like I said, sometimes I consider the babies my own, and it can be difficult separating my feelings from taking care of them. Of course, I want to take the best care that I can, but sometimes getting emotionally attached can be a little hard when a baby either passes away or something happens with their parents, or even them having a happy experience and going home. As much as I love taking care of the babies, I want to see them progress and go home, but then I never get to see them again. So that's why I'm hoping working in the developmental clinic, I'll get that opportunity to see how well the babies do in the future.
Well, you certainly will get that follow up with the patients as they come back on regular intervals. And we also try to do some annual, we participate with the local NICUs in their annual graduation celebrations and things like that. So hopefully that will give you some of what you're looking for. So how about, can you describe a situation in which you recognized a potential problem as an opportunity, and what did you do to handle that?
A situation where I was faced with a potential problem was when I was working in Rhode Island. I had a baby that had a severe birth defect and he needed surgery. And the mother was a Jehovah's Witness. So if the baby was going to go to surgery, mom refused blood to her newborn son. So it was an ethical problem that I got the opportunity to sit down with the ethics committee of the hospital, the whole surgical team and Nicu team as to how we were going to approach the situation. It was difficult to see the mother be torn between, of course, she wants to do everything she can for her son, but that wasn't in her religious beliefs. So being able to sit down with the mother and listen to her side of the story, and having the ethics committee present the reasons why they needed to do what they had to do was very eye-opening. I just was a, helping hand and shoulder for the mother to vent to, as well as us present at, the situation as to why she should give blood. The baby ended up going to surgery and he didn't need blood. So it kind of was all for nothing, but it was a good experience to see how things would happen.
Right. Yeah, so I could see how that would be difficult for a family and for the staff involved to try to balance the need for the patient as well as the religious beliefs of the family. Mm-hmm. And you will have some of those kind of moral and ethical decisions that you will be faced with in the developmental clinic as well. Mm-hmm. So it's good to know that you have some experience with that. Mm-hmm. So do you have any other questions about this job or anything else that I can answer for you right now?
You covered most everything that I wanted to know. I just am curious, what other opportunities do new employees have for training, professional development at your clinic?
Oh, sure. Yes. So as a new graduate of as a new pediatric nurse practitioner, we would have an extended orientation period. So instead of the traditional 6 weeks, we would have 12 weeks, and that would be, of course, negotiable on either side as needed. And then ongoing, you'll kind of have, we do our best to pair you with your preceptor so that even though you're on your own, we'll have the opportunity to still work with that person that you feel comfortable going to questions and some ideas off of. And then as far as annually, we do offer some continuing education courses here on site, as well as we offer a stipend so that you can participate in additional continuing education that's relevant to the developmental clinic and your patients that you see here.
That's awesome.
Okay. All right. So it was such a pleasure meeting you today. I look forward to speaking with you soon. I would expect to have an answer for you within the next 10 days.
Awesome. Thank you so much. It was a pleasure.
All right. Thank you so much for your time.